Welcome back to the Home Care OT. My name is Maddie. I'm the owner and operator of Threshold Therapeutic, and we are here to answer today's question, which is, what are hip precautions? Hip precautions are simply things that a surgeon tells you that he does not want you to do with your hip after a hip surgery. There are two main approaches for a hip surgery. The first one is called an anterior approach. Anterior simply means front. That means your incision is more towards the front side of your hip. The second approach is called a posterior approach. Posterior means behind, which means your incision is going to be more towards the back of your leg. Your surgeon is going to be the one who determines which type of approach they use to replace your hip. That's dependent on a number of factors, but that's something that they will discuss with you before your surgery and then again afterwards. So the precautions vary based on that approach. So starting with the anterior approach. Precautions, again, means things they don't want you to do with your hip after the surgery. The first one is no hip extension. Hip extension means no excessive putting your leg behind your body. So we're not doing any backward lunges or back kicks with this approach. Small step back is okay, but we want to avoid any excessive extension of the hip with that anterior approach. The second precaution for that front or anterior approach is no external rotation. External rotation means no taking your foot and turning it away from your body, doing a clockwise turn with your foot. So that sums up precautions for anterior approach: no hip extension behind your body, no external rotation. So now we're going to talk about that posterior approach. With a posterior hip replacement, there are three precautions that we need to keep track of. The first is no internal rotation. Internal rotation simply means don't take your foot and your leg and rotate them inwards towards your body. So this is taking your toes, turning them inwards in a counterclockwise direction. So first, no internal rotation. The second one is no bending at the hips beyond 90 degrees. So this is what that looks like. If I am sitting here in my chair, my hip and my trunk angle is at 90 degrees. I am perfectly fine sitting in my chair, but this means that as soon as I start bending forward to reach for something on the floor, I am broaching that 90-degree angle. So this is a no-no with that posterior hip surgery. So this makes tasks like putting on your socks or your pants or reaching to get things off of the floor a little bit more difficult. There are strategies and adaptive equipment for that, so please feel free to check out our other video series on how to use items that are in a hip kit, which are devices to help with dressing after a posterior hip approach surgery to help with those self-care tasks. One more thing to note about this no bending is some people will say, oh, I'll simply bring my foot to me to put my sock on. When I do that, I am still changing that hip to knee angle by bringing my knee up. So no bending past 90 means no bending at the waist to reach, but also we can't pick our knees up past that point either. The third and final precaution with that posterior approach is no crossing your knees or ankles. We don't want to take our thigh and move it towards the opposite side of our body. So that means no crossing our legs in the chair. We also want to avoid doing this motion for putting our socks on. We want to avoid that crossover with that posterior hip approach. If you have questions or concerns about your surgery, these are great questions to ask your surgeon before you have your hip surgery, so that way you can plan ahead on what things that you need to have in place before you have your surgery to make sure that you're set up for self-care tasks. And also, if you've had surgery and have questions, this is also a wonderful time to request a therapy evaluation from physical or occupational therapy to help you after that process to make sure that you are set up to get through your daily routine following those precautions. Thank you so much for watching. Feel free to check out the rest of our blog post series on adaptive techniques for self-care to help you along the way. Thanks so much for watching the Home Care OT. Please like and subscribe to stay up to date with our content. And for more information, head on over to our blog at thresholdot.com.